Hello everyone, I'm Dr. Yende. Today we're tackling one of the most controversial topics in fitness. It's uncomfortable, emotional, and increasingly impossible to ignore. Why do some elite bodybuilders die so young? And perhaps more importantly, what do doctors find at autopsy? First, let's be clear. Bodybuilding itself isn't the problem. Resistance training is one of the healthiest things a person can do. Building muscle boosts longevity, improves insulin sensitivity and bone density, supports cognition, and enhances quality of life. The issue is what happens when human ambition collides with biology. At the top levels of competitive bodybuilding, athletes aren't just competing with other people. They're pushing against their own physiology, and physiology always wins. Most people picture bodybuilding as discipline, dedication, and hard work. And that's true. But behind the stage lights and social media photos, there's a reality many never see. Potent performance-enhancing drugs, extreme dehydration, sleep disorders, psychological pressure, experimental compounds, and biological consequences that can be fatal. One of the most shocking autopsy findings is the heart. Doctors have found dramatically enlarged hearts. Not the healthy enlargement you might see in athletes, but pathological growth. In some cases, the heart weighed 2 or 3 times normal. A bigger heart needs more oxygen and blood supply. And over time, that abnormal enlargement raises the risk of arrhythmias, heart failure, heart attacks, and sudden death. That's why cardiovascular disease shows up repeatedly in reports on elite bodybuilders. Autopsies also reveal severe arterial changes. Many performance-enhancing drugs wreck cholesterol profiles. HDL, the good cholesterol, falls while LDL and other atherogenic particles rise. Inflammation increases, vessels get damaged, plaque builds up, and heart attack risk climbs, sometimes in people who look like picture-perfect health. It's a stark paradox. Appearance doesn't equal physiological health. The liver is another frequent finding. Prolonged use of oral anabolic compounds and multiple substances can enlarge and damage the liver. The liver is our chemical factory. It metabolizes drugs and processes nutrients. And when it's overloaded, damage can accumulate silently for years before symptoms appear. There's also the issue of thick blood, or what some athletes call sludge blood. Certain agents stimulate red blood cell production, which might sound good at first. More oxygen, better endurance. But too many red blood cells make blood viscous. Thick blood impairs flow, strains the heart, raises blood pressure, and increases clot risk. Stroke, pulmonary embolism, and other cardiovascular events. Some athletes even undergo blood removal procedures to thin their blood. It's extreme when the body becomes literally too thick to circulate efficiently. The story isn't only physical. There's a psychological side that gets less attention. Many competitors report dramatic mood swings with certain substances. Irritability, aggression, anxiety, depression, sleep disruption, obsessive thinking, and emotional instability. Not everyone experiences these effects, and compounds vary, but radically altering hormones at supraphysiological levels changes the brain. Hormones are not just muscle-building chemicals. They influence motivation, reward, mood, impulse control, and emotional regulation. Then there's muscle dysmorphia, bigorexia. Imagine standing before a mirror with more muscle than 99.9% of people and still feeling small, inadequate, or not muscular enough. That distorted self-perception drives a dangerous cycle. If bigger is never enough, there's no finish line, and risk-taking escalates. One often overlooked danger happens at night: sleep apnea. Large bodybuilders frequently develop obstructive sleep apnea. Excess tissue around the neck and airway can block breathing repeatedly during sleep, sometimes dozens of times an hour, night after night, for years. Repeated drops in oxygen, surges in stress hormones, and blood pressure spikes all raise cardiovascular risk, and many athletes don't notice until serious damage has occurred. Competition prep adds another layer of risk. Paradoxically, bodybuilders often look their best when they're physiologically at their worst. In the final days before a show, athletes manipulate water, sodium, carbohydrates, and body fluids to look ultra-shredded. Powerful diuretics are used to remove water, but they also strip electrolytes. Electrolytes control heart rhythm. If potassium, sodium, and magnesium go dangerously out of balance, the heart can stop. Several bodybuilding deaths have been linked to severe dehydration and electrolyte disturbances tied to aggressive diuretic use. I want to highlight a psychological phenomenon called summit fever. Mountain climbers know it. When they near the summit, they sometimes abandon safety, ignore warning signs, and take risks they normally wouldn't. The same happens in bodybuilding. The closer someone gets to a pro title, a championship, or social media fame, the more temptation there is to push past safe limits. It's not always recklessness. Ambition narrows perspective. And when ambition overrides biology, bad outcomes become more likely. After all of this, you might think bodybuilding is inherently unhealthy. I don't. The lesson isn't that muscle is dangerous. It's that extremes are. There's a huge difference between training for health and training to push the outer limits of human appearance. One path lengthens life. The other can compromise it. Many former professional bodybuilders deliver a consistent message. Build muscle, train hard, and stay fit. But don't sacrifice your health for a trophy. Life includes family, purpose, relationships, work, education, contribution, and longevity. As one competitor put it, "Who I am is not a bodybuilder." That's a powerful reminder. So what do doctors find inside some deceased bodybuilders? Enlarged hearts, damaged arteries, enlarged livers, thickened blood, sleep disorders, electrolyte imbalances, and evidence of extraordinary physiological stress. And perhaps the most important finding? A human body with limits. Respecting those limits may be one of the wisest choices we can make. I'm Dr. Yende. This is OXYZEN Health Intelligence. Remember, the goal isn't just to build a body that looks strong, it's to build one that stays healthy long enough to enjoy a meaningful life. Question of the day. Do you think modern bodybuilding has become too extreme, or is pushing human limits just part of the sport? Let me know in the comments below.